Good evening. This is CGTN's live streaming from the COVID-19 epicenter in the city of Wuhan. I am CGTN reporter Xu Zhaoquan. My team and I have been here for more than a month, witnessing the effort of the Wuhan people combating the coronavirus. Today, it is an honor to have Dr. Li with us. Dr. Li Shengqing is the director of the respiratory department of Huashan Hospital, which is the affiliated hospital of Fudan University in Shanghai. Is that right? Yes. Okay, great. Dr. Li also did her postdoctoral research in the University of Minnesota. She's also in charge of the intensive care unit in the Wuhan Tongji Hospital, where dozens of patients are still being treated at the moment. Okay. Today, the live streaming is actually a cross-nation medical consultation. And Dr. Li will share her experience in the last month treating the local patient with two medical colleagues. One is from Africa, the other one is from the United States. While we are waiting for these two guests to get online, Dr. Li and I will have a simple dialogue about your experiences in Wuhan, and I may have several stupid questions. Please do not laugh at me. All right, Dr. Li, you know this is not my first time to meet you.
Yes.
You may not remember, about several days ago, I was in the same ward with you when you were actually working with your colleagues treating one of the patients.
Yes.
I still remember that day you were removing the ECMO machine from
Yes.
one of the recovering patients, and I would like to know, how is that patient? Is he recovering well?
Yes. That patient was admitted in our ward for about 10 days ago.
10 days ago.
Yes. At that time, he had respiratory dysfunction and also heart dysfunction.
Oh.
So we applied mechanical ventilation to him, but he didn't respond to the mechanical ventilation very well. So we applied VA ECMO to him, and 10 days later he recovered very well. And at that day I met you. I was working with my colleagues to withdraw the VA ECMO, and now he is recovering very well. I hope he will be dismissed in a few days.
In a few days? Oh,
yes.
That's a good news. That's quite encouraging. Can you tell us how old that patient is? I was told that the older age people might be high risky when they get infected.
Yes. That is female. That is a male patient,
Yes.
58 years old.
58 years old. So 58 should be elderly. The elderly people from an angle of a doctor. Is he old?
No,
Moderately.
Yes.
Okay.
Yes. The eldest patient in my critical care unit is 86, a female patient, and he was also withdrawn the mechanical ventilation 1 week ago,
Yes.
and she is recovering very well.
Oh.
And until now we already have 15 patients withdrawn mechanical ventilation, and 3 patients were withdrawn ECMO, and all of them recovered very well.
Okay, okay, good,
Yes.
thank you. That's quite encouraging. And actually, we have collected some of the questions from our friends on the internet, because we are doing live on many of the internet platforms. Some of the questions provided a bit earlier includes, I've got plenty of questions. Well, okay, I will answer the first one, which I am deeply concerned about, because okay, let me read the question for you first. It's actually it's a question. It is from the CDC, the U.S. CDC. CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory illnesses, including COVID-19. They said you should only wear a mask if a healthcare professional recommends it. So I think I'm quite honored because I'm with a professional. As a professional, do you recommend? Okay, one more thing I want to tell you is that this morning I was CT scanned. And I think it's quite. The doctors are very effective. They told me the result just in a couple of minutes. They said I'm okay. I was okay, and okay. That's very good news for me, for a person who has been staying in Wuhan for more than a month. So I'm fine. But as a professional, do you recommend I take off the mask or I still wear it?
I cannot agree with the CDC opinion. Yes, because the patient who is infected with coronavirus, but in short time he will not have any signs or symptoms of infection.
So nobody knows whether he or she has got infected.
Yes. So at that time, he will be. He has been ill, but he doesn't know it. So it will spread coronavirus to the other healthy people. So I think it's dangerous. The best way, I think, is to put on your mask. Know whether you are to the health or ill.
Okay, good. Thank you very much for that advice. I think that's very useful. That's also very useful. I think it's also useful for those people in Europe and America who are still reluctant to wear masks, even when they are having close contact with their friends and relatives. All right, another question from a Chinese. We Chinese people share food from one dish. That's a tradition of the Chinese people. But at this moment, I think some people are afraid that dining together may get infected. Is that possible to have meals with your friends and families? Is that a possibility of being infected?
Yes, there is a possibility to be infected because when you have dinner together, you need to take off your mask.
Yes.
And then the particles of coronavirus can be spread across the pupil. I think it's very dangerous. And yes.
Okay, so we better isolate ourselves. We better keep distance from other people.
Yes.
All right.
When we work together when in the hospital, when I eat, then the other people put on their mask and just wait until I'm done. So it's a good habit for us to eat alone, and other people will eat after you finish.
Okay, great. Now we're having more questions from our live streaming on the Facebook. The question from Brigitta Bilansky. Where do used disposable masks go? To the same place as the rest of the garbage? Environmentalists already find them in the ocean. So that's a question about the disposable masks. So where should they go? But I don't think it's a question for the doctor working in the ICU. But I think you should know something about that.
Yes, in hospital, all the masks will be disposed technically, not as a normal garbage, Euro garbage, not the Euro garbage, and it is considered the medical garbage. So it has a special procedure, and I think the masks for the people outside the hospital should be disposed in the same way.
Okay, all right. Our editor is working on the computer. Maybe our guest is trying to get online. Okay, just leave it because we have plenty of questions from the internet.
Okay.
All right. Another question from Nimchiri Sherpa. I don't know which country he or she is from, but this question is, the people of Nepal. Okay, it's from Nepal, our neighboring countries. People of Nepal are not taking seriously about COVID-19. So they may think that COVID-19 is far from them. But actually, it's not far because China is a neighbor. What do you want to suggest us? Sir, it's not sir. Actually, it's a madam. All right. We're having our guest. Shall we finish that question first, and then we'll say hello. Hello.
Hello.
Hello. I think I'm talking to. I'm talking to Dr. Samrat Shah.
Yes.
Okay. Hello. My name is Xu Zhaoqun. I'm the CGTN reporter. Sitting beside me is.
My name is Shengqing from Huashan Hospital.
Okay. My name is Dr. Samrat. I'm working as a physician here.
Okay.
Nairobi.
Welcome to join us. But can you give us nice meeting you? Can you give us just 2 minutes? Let us finish that question. Then we can start our dialogue. Okay. Thank you very much. All right. We continue with that question. Okay. A question from Nepal. What do you want to suggest them? Okay.
I think because we are neighbors, and I think all of the people from China or Korea, so those countries, when they went to their country, they should be checked for the body temperature and the history of contaction and the symptoms of cough or something like that. I think this would be safe for them.
Okay, so they should take this incident more seriously.
Yes.
Okay. Do you suggest they wear masks? Wear masks like this?
I think mask is appropriate for those people in the airport or something or some place like that, because they have the chance to contact people from other countries.
Okay, great. Thank you very much. Thank you. All right, Dr. Shah.
Yes.
All right, I will give the floor to you and Dr. Lee. So now, please raise your questions.
Hello.
Yes.
Hello, I'm Dr. Lee, and now I'm working in Tongji Guanggu Hospital in the intensive care unit. I have already 72 critical ill NCP patients, and the intubation rate of my patients is 81%, 51 to 72. So, and we have already 3 patients for ECMO, and they were withdrawn safely. Now, 2 of them have been dismissed from my ward, and 1 is still left, and I think he will be dismissed in a few days. So I'm very happy to share my treatment opinion with you. Can you hear me?
Dr. Shah, are you with us? Hello, Dr. Shah. Hello.
Yes, I can hear you.
Oh, okay.
Yes, I can hear you now.
Okay.
Yeah.
Just now, Dr. Lee has talked about her experiences in Wuhan, and perhaps you were not with her. But anyway, please raise your questions if you have any.
Have you got any coronavirus disease 2019?
No, not yet.
No, not yet.
Not yet. There are only 3 cases being confirmed in the country, and all 3 have been isolated in the government sector. So as of now, no exposure to coronavirus.
That's good.
Yes.
Dr. Shah, do you want to raise your questions now, or you want Dr. Lee to talk about her working experiences first?
Yes. Yes, I would like to hear from the doctor because they have seen a lot of cases of corona. Would like to know more about the cases of corona. How are they being managed?
In the intensive care unit, which I work, most of our patients need intubation for mechanical ventilation. Yes.
Hello?
And can you hear me?
Hello?
Hello? Can you hear me? Hello, Dr. Shah?
Oh, no. All right. Dr. Shah is temporarily off the line, but it doesn't matter. I think our editor will try again to try to connect him.
He's
coming back.
connected again.
Yes.
All right.
Yes.
Nice to see you again.
Yes, dear. Tell me. Yeah, I can hear you now. So I wanted to know, how are you treating these patients in ICU?
We already have 72 critical ill patients, and the intubation rate is 81%, and we have 15 patients withdrawn the mechanical ventilation, and three patients.
Okay.
Three patients were withdrawn ECMO, and the mortality rate in my critical care unit is almost 64%. Yes, the
64%.
mortality. Yes, the mortality. So the mortality is relatively high for those critical ill NCP patients.
Okay. And any particular age group for these patients who are going for critical illness?
Sorry?
Any particular age group which is being found that the virus is more deadly into these kind of patients, the mortality rate is high in this particular age group?
Age group, yes. Almost half of my patients is more than 80 years old, and yes, the mortality is relatively high for those older people. Yes.
Okay.
Older people. Okay. What is the role of favilavir in coronavirus treatment?
Sorry, what?
Sorry, can
I
you?
read an article which says that coronavirus, to fight with coronavirus, the Chinese government has approved favilavir as a drug of choice. Is it true?
What?
Can you speak a bit slowly, please?
Okay, sorry. Sorry. I read an article from China Daily which states that favilavir is being approved by the Chinese government to treat patients with corona. Is that true? And if it is true, how much better results have you seen in these patients?
What's the drug name?
Favilavir.
Follow.
Chloroquine? Is that chloroquine?
No, not chloroquine. Not chloroquine. Favilavir. The drug name was favilavir. This is what an article was published, and it's circulating across that this is the drug which has been approved to be marketed by the Chinese government from Sunday.
I see. This you mean Remdesivir?
Remdesivir?
Sorry?
Do you mean Remdesivir?
No.
Oh.
Yeah, I don't know whether it is a fake news or what, we don't know, because that's an article being circulating across stating that a drug called as favilavir is being approved by the Chinese government for treatment of coronavirus.
In my opinion, now we have no specific or targeted therapeutic drug for the coronavirus infection. So we only have some immunological modulation therapy and multi-organ life support and anti-fibrosis therapy for those NCP patients.
Okay.
Dr. Lee, can you look at the big screens? Just look at the TV. Yes. All right.
Any role of antiretroviral therapy in this?
Would you please speak slowly?
Sorry. My speech is a bit faster. Any role of antiretroviral therapy in patients with corona?
Sorry. Yes, but I beg your pardon again.
For example, Kaletra.
Can you hear me?
Yes.
Is there any role for antiretroviral therapy in patients of corona?
Now we have no antivirus therapy, especially for those critical ill patients.
No.
Sorry, this is
No role of HIV therapy in patients.
HIV? You mean those HIV drugs
There
for?
was-
yes.
Yes.
No, the clinical trial, the data of clinical trial didn't prove them effect to the treatment of NCP. Yes.
Okay. So as of now, the treatment remains symptomatic support.
See, you mean the treatment method, treatment regimen?
Yeah. As of now, the treatment measures are only supportive care.
Yes, supportive.
Yes.
Supportive care.
Okay.
Yes.
Okay. Okay. Okay.
All right, Dr. Shah, let me have a question for you, please.
Yes.
Okay. You're in Nairobi. Are you?
Yes.
All right. Well, just you told us that in your hospital there is no COVID-19 patient. Not yet, huh?
Yes.
All right.
Yes.
But according to the media report, there have been already 3 COVID-19 patients identified in Nairobi.
Yes. Yes.
Okay. Okay.
Yes.
What measures do your country has taken to inhibit the transmission of the coronavirus or to treat the
All these
COVID-19?
3 patients, all these 3 patients have been isolated. They have been separately kept in COVID-19 wards. Apart from that, the government of Kenya yesterday ordered for lockdown. All the schools, universities, colleges have been shut down. All the airport authorities have been notified. Even the airways, roadways, and waterways have been blocked to not allow any tourists inside the country. There are so many county governments working on having hospitals at the peripheral levels as well, and trying to have testing kits available in all the centers so that even the peripheral areas can be found, can do the testing and found out the cases. There has been an emergency team being set by the government, which is assisting us all the time to find out if there is any case being found positive. There is a helpline number being given by the government. If there is any suspected case, we call them. They are coming with the team. They are taking the samples. They are testing the samples. And if anyone found positive, they are being isolated. Even the contact tracing is being done. All those 3 patients who've met in contact with around 60 people have been isolated. So there are many good measures being taken by the government, trying to prevent the local transmission of the disease.
Okay. Okay. What about the medical authorities? Because I believe that most of the medical staffs in Kenya are not very familiar with the treatment way of treating the COVID-19 patient. And how do you see the dialogues, the conversations like we're having now? Is it useful for doctors like you, or useful for the doctors in Nairobi, in the Nairobi hospitals, who might be facing the challenge of the potential attack of the COVID-19?
Yes, definitely. There is a lack of technology in the country. There is lack of resources. There is lack of knowledge about treating these patients. Definitely, these kind of interactions are going to help us in assist people to know more and more about COVID-19. And because it started from there, you are the right people to guide us about how to go ahead with COVID-19 and how to treat these patients. But definitely, we are conducting so many TV shows like this. We are conducting many awareness programs between the people. We are trying to have telecommunication and avoiding mass gatherings. By telecommunications, we are trying to teach people what is to be done for COVID-19, what measures to take. trying to train people also by having displays of banners and flyers and TV displays about preventive measures for corona. So trying all the ways possible to control the local spread of the disease, and even helping the doctors and other hospitals to get trained to how to manage COVID-19.
Okay, good. Thank you very much, Dr. Shah. I think the other guest from the United States is waiting online. Is that? Okay, I will give you 1 second to check with my editor, Zidi. Zidi, is Dr. Daniel Lucey online now?
Yeah.
Okay, all right. Just try to switch him in. Before that, Dr. Lee, I have another question from the internet for you. All right. This people's mercy. This question is from also from the same person, Belansky. Are people who smoke cigarettes more at risk or less at risk? I'm a non-smoker, as coronavirus affects the lungs, the respiratory system. All right. Do you think you have any answer for that question? Smokers at high or low risk?
Now we have no data about the risks of smoking related to the coronavirus. Yes, so I cannot tell.
But I believe that as a doctor working in the respiratory department, you don't suggest people to smoke.
Yes, I don't suggest. Only I can tell these people is that I have a heavy smoking patient who is diagnosed COPD, chronic obstructive pulmonary disease, and he is very ill in my ward, and now he's still on the mechanical ventilation, and I'm not sure he will survive this. So.
Hello, it's Dr. Lucey. Can you hear me?
Yes, yes.
Hello.
Hello, is that Dr. Lucey?
Yes, hi. I'm so sorry. I'm finally able to connect. Can you see
no
me
problem.
or just hear me?
Oh, yes.
Just hear you.
Okay.
I cannot see you. We
I've been
cannot
listening
see
to you for a few minutes, but I couldn't get through by voice. And now you can hear my voice, but you can't see me.
Yes.
I said the access is okay for my Zoom for camera, but it sounds like it's not giving you access.
Okay.
But at least you can hear me. I'm very old, so you don't really need to see me. I'm very old and I'm not very handsome, so maybe your voice is okay?
Oh, yes, definitely okay, Dr. Lucey. Welcome to CGTN live streaming about the combat against coronavirus. Actually, I'm Xu Daojun. I'm the reporter of CGTN. I'm actually hosting this small dialogue among three guests. One is Dr. Li Shengqing, the director of the respiratory department of Huashan Hospital in Shanghai. The other guest, Dr. Shah, is from a hospital in Nairobi. Actually, he has raised a few questions for Dr. Li. Dr. Shah, you are mostly welcome to stay with us. But from now on, I will give the floor to Dr. Lucey and ask him to raise a question, okay?
Yes. I can see Dr. Shah. Hi, Dr. Shah in Nairobi. I don't want to interrupt anything, though. Please, you can finish the conversation.
No, it doesn't matter, Dr. Lucey. It's your time. Okay. Well, go ahead.
First of all, and Dr. Li she's from Shanghai or Beijing or Wuhan or where? Shanghai?
I'm from Shanghai Huashan Hospital, affiliated to Fudan University. And,
yes, I know very well. I was just there in Shanghai in February, around February 18th. But and I've been in Fudan University before a long time ago, and anyway, I was trying to talk with some doctors, but now it's I wasn't successful. But now I'm glad we're able to talk. And also, Dr. Shah, very nice to talk with you in Nairobi.
Nice to talking to you, sir.
So the conversation earlier, I think, Dr. Shah, you were asking about antiretroviral or HIV medicine. So you meant, for example, Kaletra, is that right?
Yes.
Okay. But it sounds like Dr. Lee was saying that there's really been no medicines approved for therapy so far in China or anywhere else, to my knowledge. You know, in the United States, the first patient back in January in Washington State near Seattle received remdesivir, intravenous medicine, which I know some big studies have been going on in China, in Wuhan, and I think elsewhere. I'm not sure, maybe Shenzhen, maybe Shanghai, with remdesivir. So I think the whole world is waiting to hear the results of the randomized controlled trials in China, not only remdesivir, but I think there's trials with a lot of Western medicines and also traditional Chinese medicines. I think even Kaletra and ribavir and interferon, many, many things. So I think the whole world is waiting to hear the results from China. I hope they'll be at the end of this month, March, but I think for sure April. Is that right, Dr. Lee?
Yes.
Good.
Sorry, what's your question?
Will the results of the treatment clinical studies in China, in Wuhan and other places, will the results be complete and made public in the month of April coming up soon?
No, I'm not sure.
Okay.
The results of the clinical trial for Readville.
But as far as I know, that many of the doctors are also doing their own studies according to their clinical experiences. Some of them have already contributed their ideas to the international medical communities and sharing their experiences with the international colleagues, like Dr. Lee is doing now.
Yes, there's been many publications in very good medical journals.
Yes.
About the results from China with regard to COVID-19 or novel coronavirus pneumonia, NCP, I believe is the name in China.
Yes.
The name that you first gave, and I'm not sure why it was changed by World Health Organization to COVID-19, but it's novel coronavirus pneumonia, NCP. I understand. I like that name.
Mm-hmm. Okay. Since Dr. Lee has been working in the ward, in the intensive care unit for almost a month, trying to save a lot of lives in the ward who are in critical conditions, critical situations. So she has got a lot of experiences combating this brand new coronavirus. Because we have little experiences. Even the medical authorities, the medical staffs don't have plenty of experiences how to treat such kind of patient. So, Dr. Lucey, if you have any questions about Dr. Lee's clinical experiences, how they treat their patient, just go ahead. Just please ask.
Yes. Thank you very much. Thank you, Dr. Lee, for sharing your experiences on this CGTN webinar. It's very, very valuable to share your experiences with Dr. Shah and myself and other people around the world. So I really have two main questions for you, if it's okay, Dr. Lee. The first one is about anything that you have been able to do to prevent people from requiring intubation, being on a ventilator. For example, the antibody to the interleukin-6 receptor, I think it's called tocilizumab. I've read it on the China, the National Health Commission website, that there have been studies going on, and also that on March 3rd, the 7th version of the National Health Commission guidelines for NCP, for diagnosis and treatment, it said that if the patient is severe or critical, that you can give them this antibody against the interleukin-6 receptor. Are you doing that in Shanghai, in your hospital?
You mean the antibodies derived from those recovery NCP patients?
No, I mean the monoclonal antibody that it's called tocilizumab. It's against the interleukin-6 or IL-6 receptor, and it's made by a company called...
I see.
Okay.
I see. IL-6 receptor antibody, monoclonal antibody. Yes, I have one patient in my ICU ward who used this Tuozhu monoclonal antibody, but the effect is not so well. The patient died. So, in my opinion, this coronavirus infection usually causes the inflammatory storm, and this inflammation will cause damage of alveolar and the other organs, for example, heart and kidney, and this inflammation storm can only be inhibited by the steroids, for example, glucocorticoids. And we usually treat these critical ill patients with the combination of glucocorticoids and intravenous immunoglobulin. And because all the people in the ICU is critical ill patients, so they need multi-organs life support. For example, mechanical ventilation, and the intubation rate in my ward is almost 81%. And also the CRRT, even the ECMO, and VV ECMO is the most used mode, and VV ECMO is usually used for those people with respiratory and cardiac dysfunction patients, and because the high coagulation, the high risk of venous thromboembolism, we usually use anticoagulation therapy, especially prophylaxis anticoagulation therapy for those patients. And because of the infiltration of lung tissue and also the damage to the heart, so we usually use volume limitation method to diminish the infiltration, the lung infiltration, and the preload of heart. And for those people, the recovery from the coronavirus infection, almost 1/3 of those patients have pulmonary fibrosis. So we usually use anti-fibrosis regimen for the treatment of those people. And the regimen is a combination of glucocorticoids and N-acetylcysteine and pirfenidone. Those patients treated with these 3 drugs usually recovered very fast, and shorten the duration of hospitalization. The patient, when use these 3 drugs, 1 week later, when we check the CT scan, the most shadow in the CT scan of patients' lungs will dissolved. Most of them will dissolved. So I think is a good regimen for anti-fibrosis. And the last method treatment for the critical ill patients is pulmonary rehabilitation. The pulmonary rehabilitation is very important for patients to diminish their symptom burden, their usage of oxygen, and it will shorten the duration of hospitalization dramatically. So this is my opinion for the treatment of critical ill NCP patients. So now, until now, 15 patients were withdrawn mechanical ventilation, and 3 patients were withdrawn ECMO, and we have 10 patients dismissed from the intensive care unit. So I think is good results for fighting 1 month fighting.
Well, great.
Yes, thank you. Thank you very much, Dr. Lee.
You're
welcome. Was a little bit. There's some voices in the background. So I could hear what you're saying, but not perfectly. It sounds like you've had a lot of success treating patients in their intensive care unit, including with pulmonary fibrosis. And
yes.
You mentioned 3 drugs.
Yes.
I think 1 drug was corticosteroids.
Yes.
And what is the second drug? Was it anticoagulation treatment?
The second drug is an acetylcysteine.
Oh, okay, yes, an acetylcysteine. And then the third drug?
Pirfenidone. Pirfenidone, Pirfenidone.
Okay, and what is pirfenidone? What does it do? What does it do?
This drug targets TGF-beta signaling pathway.
Oh, for the fibrosis, the TGF-beta trying to.
Yes.
Yeah, very interesting. That's very. It's very creative. It's a very good idea, I think. And you say that it's working. So you're inhibiting the TGF-beta?
Yes.
Yeah, what a good idea.
Thank you.
And then one week later, thank you. Then 1 week later, you repeat the CT of the chest?
Yes.
With no contrast, right? No contrast CT scan, right?
Yes, no contrast.
No contrast. And you see improvement and improved oxygenation also in the patients?
Yes. The symptoms of those patients improved, and also the CT scan improved dramatically. Yes.
Yes,
dramatically.
So can I just ask you, Dr. Lee, have you or any of your colleagues in Shanghai or Wuhan or Shenzhen, anywhere, have you published this treatment protocol, or is it on the website of the National Health Commission, or is it available somewhere? Because I haven't heard about it, but it sounds very successful and very helpful, you know. So is it published yet or no?
Yes, I just write a Chinese paper for publication in China, and another English paper. It will published in the in English journal. Let me.
In the New England Journal of Medicine?
No. I can tell you.
Yes.
I can tell you the
Wonderful.
Journal name. The journal name.
Is the journal in the United States or in European countries?
Sorry. Sorry. The journal name is Emerging Microbes and Infections.
Microbe and infection.
Yes, emerging microbes and infections. I just submitted my English article paper in this journal last night.
Okay, good. Okay, so hopefully it will be accepted and published online very soon, I hope.
Thank you. I hope so.
All right. Dr. Lee, is it an online magazine or it is a published one?
It is a published one.
It is a published one. Okay, but hopefully it will get online soon. Yes.
I think it's available online as well.
Yes, I think.
Yes.
Okay.
Okay.
I think
Great.
so.
Okay. Before you have any more questions, let me give you a few minutes to the questions from the internet. Okay. All right.
Yes.
Okay. First of all,
Yes.
I want to thank our friends from the internet for their advice. They told me in the comment on the streamlining website. They said I better not touch my face and my mask frequently. Okay. Well, thank you so much for that advice. All right. Okay. We have a lot more questions from YouTube, and Twitter. It was how cure this virus, because we know that you have recovered now. All right. Thank you. It was in Tanzania. I'm in Tanzania. Okay. Dr. Shah, we have a lot of questions from African countries, because I think it's mainly because you are here with us. Another fact from, actually, I think it's from Tanzania, Mr. Mwesiga. Okay, his question is, Dr. Lee, thank you for your experience. I'm a Tanzanian currently studying here in China. Oh, he's in China. Okay, he just wants to know your advice, advice for the countries with the newly reported cases, like their country. Actually, this is quite the same with Kenya. Is that right? So, okay, Dr. Lee, just let us know what kind of preparations the people should do if they just start their campaign, their combat against the coronavirus. If they have only a few patients and they don't have plenty of experiences of how to do the treatment, what kind of preparation do you think they should do for the medical authorities, for the hospitals and doctors and nurses?
Yes, I think the newly found patient should be collected in hospital as soon as possible, and also all the people connected with those patients should be checked and isolated also.
Okay, so your advice is a bit different from what the British people or British government is doing at the now, because they said it's not necessary to test everybody, to test every patient. If you feel ill, but you have a very light syndrome, which is not very serious, you better stay at home and do not need any test. Do you agree with that? Do you think every patient should be tested?
In my opinion, I think every patient should be tested because I have been fighting in the ICU ward for 1 month, and as I know, the progression of NCP patients, especially those critical ill patients, progressed rapidly, and the mortality is very high. In my ICU, the mortality is more than 60%. So you can see 60% people will die in 1 week. And I think this is a very bad thing.
This is very bad. This is very bad.
Yes. Yeah. So I need. I think government should take some
measures to prevent those patients of light symptoms from becoming serious.
Yes.
Okay. All right, Dr. Lucey, do you have any more questions for Dr. Lee?
Well, yes, just briefly, the paper in the Chinese medical journal about the treatment, is it already published? Is it available? If I could, translate it, or is it published in the Chinese journal that you mentioned already, or not yet?
You mean my Chinese paper?
Yes, Dr. D, yes.
My Chinese paper will be submitted tonight after this.
Yes, after
talk.
this live stream. Yes.
Okay, wonderful. Thank you. Are other hospitals in China, Shanghai or Wuhan, Beijing, have they also tried this 3-drug treatment regimen that you've had success with, including the inhibitor of the TGF-beta?
I'm not. I don't think so, because we have 7th edition of guidelines for the treatment of coronavirus infection. I didn't see the recommendation of these 3-drug regimens. But according my clinical practice, I found the fibrosis for those recovering patients. So I use this 3-drug for the treatment, and I found the results is very good. My patient recovery quickly, very quickly. So
yes, it's very good news. And did you say that you've treated 10 patients, or how many patients have you treated with the 3-drug regimen? How many patients?
12 patients.
12. Okay.
12 patients.
Okay. Okay, good. Well, thank you very much, Dr. Lucey. We don't have much time, and I would like to leave the rest time for Dr. Shah. This is the last question from Dr. Shah. Okay, is that good for you, Dr. Shah? Do you have just one more question?
Yes, I have quick 2 questions.
Yes.
Any role of immunoglobulin therapy? First thing. Second thing, if there is a bacterial infection superadded, what antibiotics have you found to be useful? And if there is organ failure, which is the most common organ failure you have seen?
Sorry, the network is not very good. Can you repeat your question a bit slowly, please?
Any role of immunoglobulin therapy? You mentioned something about IV immunoglobulins. What is the role of immunoglobulin therapy with the triple regime? First thing. Second question, if you see multi-organ dysfunction, which is the most common organ you have seen to be affected apart from the lungs?
Okay, first question.
Yes, I can only get your first question. The intravenous immunoglobulin therapy. Yes.
Yes.
As you know, the immunoglobulin therapy is not used alone. It is combined with glucocorticoids for the treatment of NCT patients, because those immunoglobulins can be used to inhibit the toxins and inhibit the spread of coronavirus and inhibit those inflammation damage of all the organs, including lungs. So, and also it can also block the secondary infection of other organisms. So that's why I use it.
Okay, great. Thank you very much, Dr. Lee, and thank you, Dr. Shah. Thank you very much, Dr. Lucey. And would like to thank all the friends from the internet. It is my great pleasure to have this dialogue with three top-level medical experts who have been talking in the last hours about something like that, and I totally don't understand, but it's still my great honor. I think it should be quite useful for the people who are still doing their preparations for this fight against coronavirus. Just one more thing, Dr. Lucey. What do you think? What do you think of such kind of dialogues? Is that useful for you?
It's very useful for me, and I thank you very much, and CGTN, and Dr. Lee, and Dr. Shah. And I hope that maybe we could do this again in the near future, because things are happening so quickly. You know, now in the United States, more than 3,000 patients that we know of, but I'm sure there's many, many more because we've had trouble with testing, obviously, doing enough testing. So it's very valuable to me, and I thank you very much. And I would love to hear more from Dr. Lee about her 3-drug regimen. I think it's very interesting and creative to inhibit TGF-beta to block pulmonary fibrosis. So, you know, this has been very valuable. Thank you very much to everyone.
Okay, great. Thank you very much again for joining us. Especially thanks for Dr. Lee, and also my sincere thanks for the people joining this live streaming and watching the live streaming from CGTN. Thank you very much for your precious time, and we'll continue to do the same thing in the next couple of days. And tomorrow evening we'll do another cross-nation medical consultation with the doctors from the Peking Union Hospital. Okay, thank you very much. See you tomorrow.
Thank you.